Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department. I'm talking to Dr. Russell Stevens. He is a physician with us here at Family Health. Dr. Stevens, how are you?
Good morning. I'm good. Thank you.
Thank you for being here. We are talking about something that we know very well about in the South, which is diabetes. But people know the name, they know the phrase, they know the terminology, but that's about it. So let's tell people a little bit about what is diabetes.
That is so true. There are so many patients that really do not know what diabetes is all about. They think it's just a high blood sugar. Um, but there's actually two types of diabetes: type 1, type 2. Type 1, you generally see, it usually appears in the young age. And I've seen it in just a few months old. Type 2 usually occurs later in life after 40 years of age. However, I I have seen type 1 appear later in life. So it isn't always true that the young are type 1 and the older type 2. You can flip flop those as well. With type 1, usually that's caused because the islet cells of the pancreas, which is the part of the pancreas that makes insulin, is no longer functioning. In
Mm.
type 2 diabetes, they make insulin, but for some reason they don't make enough insulin, or the insulin they make does not work as well. In both cases, blood sugar goes up.
So you've been working with diabetes patients for over 20 years. So you're
Yes,
very familiar with um, the effects. I mean, that's one of the things I think you just mentioned is that anybody is susceptible for diabetes, any age, male, female. So there's really nothing that says, okay, I'm safe, I'm not safe. Um, so what, someone's curious about it. What are some of the warning signs for diabetes?
well, in children, if you have a child that has never wet to bed before and then all of a sudden they're wetting to bed, they're not gaining weight, you should the doctor should consider diabetes. In adults, it's um, polyuria, which is frequency of urination, uh, weight loss, no energy, headaches. Um, those are the symptoms that you would most frequently see.
So if somebody's experiencing something like that, they probably need to start off checking in with their physician, their primary care provider. And then, you as a provider, you would run a series of tests and kind of determine those things.
That's correct.
So let's say someone, exhibits some of those symptoms, they go to see you, they get tested, you've determined that they do have diabetes. Um, how do you treat it?
Well, that depends on whether type 1 or type 2. Type 1 diabetic, you're going to start them out on insulin. You can't use the oral medications for a type 1 diabetic. A type 2 diabetic uh, is just the opposite. They you do start them on oral medications such as metformin, uh, amaryl glipizide, uh, Bydureon, Trulicity, Ozempic. Uh, those are just a few that you can use.
So we've got to be really cautious about diabetes in the South. Historically, we're not as active as other parts of the country as far as physical activity, and our diets are completely different. So, any other type of advice like that you would give to people other than walk more often and watch your diet?
Weight loss, in the South here, obesity is a big problem, and that is a big risk factor for diabetes, as well as family history.
Mhm.
Um, you know, um, just basically if you have family history, take care of yourself, exercise, eat healthy, lose weight, see your doctor on a regular basis.
Well, you should also be mindful of the food labels as well. So you're looking at everything that you're putting into your body, the calories, the salt, so it probably wouldn't be a bad idea to also talk to a nutritionist too.
Absolutely, that's part of my care plan.
Well, Dr. Stevens, anything else you'd like to add, uh, to talk a little bit more about diabetes?
Yes, just controlling your blood sugar isn't enough. Okay, you you need to also see an eye doctor on a yearly basis. The eye doctor needs to look at the blood vessels in the back of the eye to look for diabetic retinopathy. A diabetic needs to check their feet every single day, look for cracks between their toes, look for sores, um, because in diabetics, one of the complications is neuropathy, and they lose feeling in their feet. They can step on something and it penetrate their foot and not know what's in there. And I've seen many diabetic foot ulcers arise from that. Um, you need to control your cholesterol because diabetics have a higher incidence of heart disease as well as stroke. So they need to have their cholesterol monitored. And it need to be that you be on a medication to control their cholesterol. You want to control cholesterol much more tightly in a diabetic than someone that's not a diabetic.
You know, talking about diet real quick before we wrap up, we tend to say a lot here in the South, if it's green, it's trouble. If it's fried, give me double. So um, let's everyone be mindful of their diets. And, there's a lot more symptoms, obviously, you just kind of hit the cliff notes of the symptoms. But if you're starting to exhibit something that you weren't doing last month, last week, um, go see your doctor, your provider, and just, talk about those concerns that you feel like you would like to have some tests that, maybe it is an onset of diabetes, especially for juvenile diabetes as well. So it is treatable, obviously. So, we want to try to be able to get someone in, starting treatment early, sooner than later. Well, Dr. Stevens, thank you so much for your time, and thank you for giving a little insight on diabetes.
Thank you for having me.